Okay, I think we can start. Hi everyone, I'm Anvesha. Welcome to today's session. Today's talk is a part of a series that we're doing on AI and risk mitigation, where we're exploring domains of health tech, agri tech, education, and public services, and talking about various use cases of AI in these areas, and also specific risks regarding these domains and use cases, and also strategies and best practices to mitigate the same. So today's talk is by Sharika Varma. She's engineering manager at Ada Health. So the structure for today's talk will be Sharika will start off with a brief talk, and then it'll be followed by a discussion with Dr. Anand and Dr. Hannah, who are the consulting editors for this project. And then followed by audience Q&A. So if you have any questions, you can drop them in the Zoom chat or YouTube, wherever you're watching this from. And so today's talk will be about ensuring safety and reliability of digital health solutions. And so we'll explore best practices, strategies, and regulatory considerations for the same. Sharika, over to you.
Hello, everyone. Can you hear me?
Yeah.
Okay. Yeah, so good morning, everyone. I'm Sharika. I'm currently working with Ada Health, as Anvesha already mentioned. Ada is basically a digital healthcare company, which is based out of Germany. It started in 2016 and it was built by doctors, scientists, and engineers using medical AI to simplify the healthcare journey. Uh, Basically, it's a symptom assessment software application that uses custom probabilistic reasoning technology to support better health outcomes. My role here is engineering manager, and I'm currently managing two teams. One focused on building internal tooling to develop, test, and translate medical content, which is needed for the AI core, and another focusing on care navigation and digital triage, which is basically the journey that comes after the assessment. Yeah, so in my position, I basically focuses on end-to-end delivery of features and enhancements and monitoring like multiple projects in these particular areas. Yeah. So I have not, sorry, I've not like prepared any presentation or anything. So I could maybe jump into the questions you have, and probably that'll have a better structure to explain a couple of points. Would that be okay?
Yeah, sure. Anand, Hannah, you can go ahead.
Anna?
Sure, no problem. Sorry, can you repeat the question again?
Anand, you're on mute.
I think we can start asking, more directed questions so that Sharika can answer them.
Yeah, because I don't I'm not prepared any kind of presentation or anything like that.
Yeah, that's fine.
Okay. Okay, so given your experience working with health tech and specifically for health in EU, I think one of the key things that we would like to start off the discussion is, to get into the consumer space. What are some of the key steps that any application needs to go in to become a medical device or obtain a medical license to be able to practice in EU?
So in European Union, so I can speak within the scope of my company and some of the steps they have taken. But yeah, it's not like generally across, globally, but it's specifically in the EU region. Medical applications have to be classified under something called as MDD and MDR. So MDD stands for Medical Device Directive, and MDR stands for Medical Device Regulation. ADA's application is an MDR certified Class 2A level. And in European law, a directive is basically a set of guidelines setting minimum standards that can be interpreted by each European member state. Basically, it's a powerful body for assuring conformity of medical devices across the European marketplace. So some of the it's a very extensive process. It takes months, sometimes even up to a year to get certified. So it's a huge thing. But I can just run through like some highlights of some of the things that can be kept in mind. So for any application, once the intended purpose of it and has been identified, and the use cases have been defined and requirements gathered. I'm sorry. Can I continue?
Yes, please do.
Okay. Once the use cases have been identified, there are certain factors that needs to be like embedded into the whole software development lifecycle. And one of the key aspects is called the QMS, which is a quality management system. This should be established and very much integrated into the whole development cycle. A quality management standard for MDR is basically what is known as this ISO 13485. So you need to become certified to get this standard. And ADA, for instance, complies also with GDPR, ISO 27001, and HIPAA, and so on. So what QMS essentially is basically an extensive set of documents which basically includes all the aspects of the applications with its technical documentations, the architecture guidelines, the validation reports, test reports, deployment plans, change requests, pretty much all the information that is going in during the development of the application has to be extensively documented and recorded with a certain version label to it. And this is a little different from the typical agile model of developing a software where documentation is kept to a rather minimum. This is actually quite the opposite. You really have to have a properly validated, documented set of records, and this is maintained for every change quite extensively. So this is one of the main areas that is usually checked as a part of this licensing. Besides that, there is clinical evaluation, which is basically like essentially a detailed literature and a theoretical and scientific assessment and appraisal of existing data from many different sources of clinical data. There are no human subjects involved here, but it's just the literature to prove that the device achieves its clinical aims, its purpose and all its requirements. And this is also an essential part. So this clinical evaluation report is also part of the whole, auditing process and so on. And MDR also requires the organization to be fully GDPR compatible, which is basically to kind of understand the data security requirements, encryptions, user permissions management, audit logging, consent management. So all these comes under the GDPR aspects. It's very essential to implement the proper data security both on the front end and back end of the application, which must be pretty much from the start thought in the design overall. And following that, we have post-market surveillance, which is a very important thing in the whole process, which is a surveillance that is required to ensure that patients are not exposed to any kind of dangerous interventions or deprived of access to beneficial innovations and so on. This is usually carried out by like a safety team or a validation team to validate the intended use of the application, to get feedbacks and to analyze risks. So yeah, this surveillance is an extremely important aspect as well to be part of the whole certification process. yeah, these are some of the highlights I can remember that has been touched upon in some of the projects. But as I said, certification comes from a notified body and takes months to achieve. There will be periodic audits and checks conducted within the organization by an external body. So in EU, for example, TÜV is one of the external body that does these MDR certifications.
Yeah. A very extensive set of rules and guidelines. So, sorry, but sorry. Does this do you kind of, even if it's ultimately a software intervention, is it treated like it's a medical device? Because that's something that we are seeing almost everywhere, that we kind of repurposing the medical device guidelines for machine learning models and other kind of these things.
So it is authorized to be treated as a medical device once you are MDR certified.
Okay.
So it pretty much has to follow the exact same standards as any other medical device available in the market.
Okay. And cool. So in the sort of development of um, symptom checkers or different types of these ML based systems, what are the different types of models you've come across? And we talk about black box models and and things like that. So how do you sort of think about these sort of issues and their relevance to risk?
Yeah, I think it's extremely relevant. And personally, I have only heard about like white box and black box models, but I know there are other types. But currently, I think this is one of the important aspects of AI. But before getting into like white box and black box, I think it's very important to understand two fundamental concepts here, which is something called explainable AI and interpretable AI, and what they mean. So, explainability is basically the human ability to kind of access and understand the explanations for the decisions, the predictions, or the outputs basically returned by an AI system. A very explainable AI basically is, for example, the typical ML classifier, which classifies a certain species as a particular, category, and it's kind of easily understandable why this model classified this as a particular species, because it can be well explained through, decision trees, yes or no flow charts, and so on. Whereas the next concept is interpretable AI, which means it focuses on understanding how an AI system works from the inside. It could be an algorithm or a trained model or a series of, operations. So both these concepts are very similar, but explainability basically focuses on getting on the outputs that are derived from the inputs, whereas interpretability aims at understanding the internal AI workings. And based on the degree of these two concepts, like interpretability and transparency, that's how models are classified into white box and black box. So, white box systems are fairly transparent and interpretable. They use much more understandable logics like, linear regressions, decision trees, and so on. And for example, bias in a probabilistic model is one of the common examples here for white box, which models out the probabilistic relationships between conditions, symptoms, risk factors, and other attributes, and using that to construct the algorithm. These algorithms, it's kind of easily shows how a combination of attribute values in a new data observation basically leads to a specific output. And yeah, so that is the crux of it. Basically, in white box, it's kind of more explainable and more interpretable. On the other hand, for a black box AI systems, these models are generally more complex and more sophisticated. They are much more powerful, and there is a lot of room to scale and innovate in a black box model, like the deep learning models, which has a lot of layers of neurons, connections, and computational processes behind the inferences. But the trade-off is that it makes it really hard to understand why a particular prediction has been made. So if you look at the LLMs, which are quite common these days, is a black box model, and hence, if you see the risks, it's much higher for black box than white box, because of this lack of understanding of how it works and how a decision has been made. So ensuring basically an optimal level of transparency of these models, combined with right amount of the expertise, clinical expertise, is very essential, especially in the healthcare industry, for any applications that are using these kinds of technologies. Yeah, that's kind of what I can explain about white box and black box models.
Okay.
So from a perspective of when we design models, specifically, how do we ensure that it is designed for a particular population or culture? Now, if we want this application system app to work across cultures or geographical locations, is that something that is considered upfront? And what are the ways that these are thought through when a product is developed?
So keeping that as like a larger topic here, I think one of the most important aspects that come in this is the common term which we have heard, known as the algorithmic bias. So if you are working across different population segments, if you want the application to work across different geographies, we need to ensure that there is no algorithmic bias, or at least this to be kept at a very minimal level. So there is always a serious risk in that case when AI models are trained with historical data. Deploying this model can kind of perpetrate or even amplify the past biases embedded in the data. So if you do not accurately represent the diversity of populations, leading to this could lead to biases. And for this, it's very important to basically start with the data set. So that's like the starting point, to ensure that the data is represented well. The quality of data is really good, and this can be basically done by not taking a look at it and making sure that there is no too few cases of a population segment. Assemble the data in a way that it contains cases. So if you're talking about the medical side of things, contain cases which are relevant for every population segments, especially those with the risk of AI bias. This can be done by having conducting clinical studies in these underrepresented populations, and take them as the sample cases for training the model and so on. And another way this basically can be kind of mitigated is to make sure that the organization itself has a very diverse AI talent pool. So having a like highly diverse medical and engineering team to kind of represent the human diversity, and advocating inclusivity and participation in an AI-driven society is like very important uh, as a culture in the organization, so that they don't end up building an application specifically for just a small segment of people who are not that well represented. And this takes time, because this needs to empower individuals from like various diverse backgrounds to engage in AI related activities and kind of do like a participatory decision making, so to say. So these kinds of steps actually can help in making sure that the application is also fit for a larger population and larger segments. But besides that, there can also be some technical fixes, so to say, like adversarial debiasing, which basically uses one AI model to reduce the bias in the other. So, for example, if you are assuming race as like the most likely bias which inducing attribute in an AI model, uh, then the second AI model will take the output of the first model and try to guess based on all the attributes other than race. And if it can do so correctly, and if the output of these models are pretty much the same, then this would basically mean that there is very little difference that that particular attribute makes. So there are some technical fixes which is mostly done during like the testing phase of prototypes and so on. Also ensuring like fairness quality checks, so that it model can be released for like a general use, basically using two different subsets of historical data and kind of masking all the sensitive attributes like race, ethnicity, or skin color. All those aspects can be kind of masked, and outcome can be validated on one model and another model which basically where they are not masked. And if that doesn't make any difference, then this basically means you have a bias free or minimal bias models, so to say. So some of these steps can be incorporated, but what is important is to ensure that the data sets being used, the medical cases being used, are as diverse as possible by doing these clinical studies and so on. And also the company in itself incorporates a very diverse AI talent pool. Does that answer your question?
Yeah. Thank you. That was quite a sort of a detailed answer. Thank you for that. And I think, the importance of having diverse, talent and people working in your organization is I think, is criminally underrated. And I don't think there's any way around, engineers and other professionals who are working in like kind of get involved in. It's not something you can delegate to the management. It's something that everybody kind of needs to be involved in.
Right. And diversity in terms of not just cross geographical or demographic diversity, but also in terms of working within the organization. Like one of the important aspects is to have like a AI governance committee, which should include people from all cross-functional domains, to ensure that all aspects like regulations, compliance, legal, medical, quality, along with engineering, they are all working together and collaborate together, so that there are no gaps in all those domains, so to say, while building the technology.
Yeah, I think that would be very useful.
Talking about, so is there something that you can elaborate for us a little bit about legal compliance when it comes to using models as medical devices? What are some of the legal compliances that are generally used across the world and specifically in the EU region?
Sharika, you're on mute.
I'm sorry, the common point. So European Union is like one such government that is actively contemplating regulatory actions, especially in use context where harm could potentially be caused by a biased AI model. So this is a body that has a lot of regulations that has been put in place. For example, GDPR, which mandates data subjects' rights, data protection impact assessments, data protection by design, etc. And so these international bodies exist. We also have HIPAA, the United States Healthcare Protection Act, which also kind of sets down a key set of regulations that applications should follow in the medical industry. Yeah, so there are quite a few bodies out there that sets international standards for specifically also around AI applications. And it's important that every company adheres to those regulations to make sure that, the application they are developing is like standard and compliant for using for like commercial use or, bringing it into the market. Um, Internally within the company, as I mentioned already before, it's important to kind of assign clear roles and responsibilities for AI governance, which includes like oversight bodies. um, there should be a government committee with, like, as I mentioned, cross-disciplinary members to kind of oversee AI initiatives. And ADA, for instance, has a medical safety team which does a fabulous job in overseeing all these safety aspects of the application. We also have quality and regulatory teams that are also embedded within every team from the beginning during development. So some of these structures and both internal and external standard international bodies also help in bringing a certain structure into the company. And besides these, there are also like data governance and engineering standards that needs to be followed, which includes basically like frameworks for secure management and compliance of data, ensuring security like through access management. So very controlled access management of applications. For example, we also have like toolings inside, internal toolings that are developed, which needs a separate access management within the company. And not everybody is authorized to, access those tools. Two-factor authentications, using VPN, putting applications behind a tunnel. A lot of such practices are like important to ensure safety and, make sure that everything is correctly regulated. Four-eyed principle for like repositories, and a very well structured change control system and release management process, etc. All these are like fundamentals to make sure that the product is compliant by all means. And there are also aspects like strong encryption, audit logs, data anonymization, etc. They're all part of like building a very robust data governance inside the company. Then there are also info security teams that ensure that there are periodic vulnerability checks to make sure that, we handle all the security threats immediately. Yeah, and yeah, that's all I can think of in the top of my head. Like some of the practices that can be brought in an organization to ensure that there is always a good oversight of regulatory compliance. And of course, the legal team definitely looks into the legal aspects of making sure that the product is kind of, launched within the permitted limits of every country's legal regulations.
Okay, yeah, thank you. That was quite a lot of um, detail. Now, you mentioned that, there is some kind of an aftermarket or post-market sort of surveillance kind of a thing that happens. So what are some, given all of these different types of things you need to watch out for, what are some feedback mechanisms that are, you think best practices that need to be there in these products? And when I say feedback, I mean, after you launched it, feedback from, the patients and from doctors, people who are not part of the company.
Mhm. So close monitoring is a essential part of every application, like understanding how the market has received the product, how doctors are working with these applications, how much of use they see in this. So there are surveys and clinical studies and surveillances being conducted regularly to ensure that the particular application is not deviating from its intended purpose. So feedback mechanisms, basically, we do have as I mentioned, the medical safety team, which also includes doctors, and they are closely working also with actual doctors who are working in clinics, who use these applications, and the cases from there are also used as a feedback to loop back into the AI core, but in an anonymized and masked way, so it's not like a direct feeding. Um, and all these multiple channels, like cases from different clinics, then post-market surveillances, surveys. It also has enterprise clients that use, so feedback from them, reports and assessment reports from them. A lot of these informations are like fundamentally gathered in a BigQuery database and evaluated very periodically. So almost all the feedbacks coming in are also monitored within 24 hours and responded um, in case there are some minor concerns or something. These are almost immediately addressed and validated by the safety and validation teams. So yeah, the feedback channels are properly in place, just like any software application. We also create tickets and bugs and handle it with high priority within within the defined um, time zones.
This is more of a personal opinion question that, okay, we are now seeing a lot of self-use applications where you can assess your different aspects of one's health. But
Mhm.
do you see a risk in general public using these kind of apps as well? Yes, we understand that it's in some sense useful for them to be able to use it on their own device, but from the market perspective or as an AI professional, do you see the risk in people not so well versed with either the technology or with the medical jargon itself using these applications?
Yeah, so definitely it depends on several aspects there, like what kind of application and what kind of advice it is giving, and where is the information coming from. I think these are like the fundamental things that every user needs to first understand before they act on a certain output of that application. So to begin with, I think often risks are because of the lack of knowledge of an end user on how to interpret the information coming out from the application. So that's why all these, whatever I mentioned so far, the regulatory compliance aspects, the credibility of the organization, the type of model they are using, is it white box or a black box models, all these are important elements that a person should also understand before they decide to act on it. So for example, in case of a symptom assessment, when a certain condition has been detected, when you go to a normal, like when you go to a doctor, and if the doctor informs that this is the problem, very often, if it's like a severe case, if they ask you to do a surgery or something like that, you also try to understand what was the what was his thought process, how did we identify, what were the reports, and you also try to get a second opinion sometimes from a different doctor before you immediately decide to jump into the surgery, right? Most of the cases. So that level of common sense and reasoning should also be kept in, while using these applications, that you should not right away jump into the advice, but try to think about it. And it's also equal responsibility of the builders of these applications to also ensure that the information is always provided with a certain disclaimer that this is if in case you feel, like for ADA we say, in case you feel that your symptoms are getting worse over time, or you feel inherently that not that well, and you start bleeding or you feel severe headaches and things get worse over time, then immediately go to a doctor. And even at the start of the assessments, it says it's not like, an application to replace the real medical advice from a doctor, but rather something to, support you or help you. So there are situations where an application like that would help a person who wants to kind of, get a first hand review of the symptoms they're going through at home, because we all know how overly saturated the medical system is and how difficult it is to get an appointment and, go there and finally reach the doctor. So during that time, an application like this would really help to give you like a first hand idea of what's going on. But it needs time before you act on it. I don't think we are there yet to completely allow AI to, autonomously make decisions and give advices. And that's why it's very important to have all these regulations and certifications and things in place for applications, and also for the companies to gain their credibility. Yeah, but it also depends on where the information is coming from. So if the medical content that is being used in these applications are curated by the doctors themselves, like some of the symptom assessment companies follow that model where in-house doctors build that medical content and feed it to the engine. And this is only from like very published journals, and it also goes through a very extensive review process within the doctors before you actually feed the data into the model. So in that case, the risk is much less because it's only within that data set that has been expertly crafted by these doctors that is being used in the model. But in case for LLMs and so on, it's public data. So the model initially is trained on public data, and there is no source of where the information is often coming from or how well we can validate it. So in that case, you really cannot accept the responses with 100% confidence. There is always, some element of uncertainty there. So yeah, this is my take on it. Like, end of the day, use your common sense and reasoning before you act on it. No applications are any kind of replacement for the doctors. So over time, based on your gut feeling and based on how bad your symptoms gets, it's absolutely essential to get a doctor checked up, depending on how bad the situation is. But at the same time, such applications can also be tremendously helpful for sharing information on non-risky areas, um, like what's going on with your body or what phase your body is. These are all like some, general information, that harmless information that can be shared. Um, for example, like periods or something like that. So basically, I think the source of information, the type of application, and the kind of advice being given, it varies across different areas, and therefore I can't give like a very straightforward answer. But my point would be, use your common sense before you act.
Yeah, I think that's fair. Yeah, so I think we have kind of coming to um, the end, and I just wanted to ask, how's the reception been? What do doctors and patients and research people and things like that? What's the feedback or what's the reception been like?
Yeah, so of course I can't speak for the much larger audience, but from my personal opinion, I think the reception has been reasonably good, especially in the last few years when there has been like a dramatic increase in the number of people adapting these technologies. Um, Basically, I think the simple fact that most of these organizations that use medical applications have now embedded doctors in house and included them in the process of building it has already proved that the medical industry, for instance, is slowly starting to accept the tremendous change that technology can bring in the industry. So I would say people are generally excited about all the possibilities that technology can bring. The scale of innovations, the especially around the fact that since most of the healthcare systems are highly saturated, we have very few doctors and a lot of people. Uh, Usage of such technologies can really support in kind of triaging, like categorizing people for those who need, who can do like um, some kind of home care remedies, or those who needs like most urgent care. These kinds of categorizations really help in reducing the burden on our healthcare systems, especially in US and Western countries. It can also bring a lot of opportunities within countries that do not have enough healthcare systems. They can easily access credible care through technology, even though they don't have like much healthcare support and doctors. So people undeniably agree the benefits of AI and how much it can impact on especially healthcare. Also in terms of improving your health, overall health, or identifying, diagnosing diseases much earlier. So there has been a lot of evidences to prove that technology can be really helpful, and if collaborated well with the medical industry, can do really well. So people do understand that, but at the same time, we are not in a place to entirely rely on these technologies, and that's where human oversight is definitely needed, and a collaboration together with medical experts and researchers who understand how algorithms work is very important, and all this should go hand in hand. So yeah, from my opinion, I think the reception has been good. There is no resistance to adapting this technology, but we are yet to go when it comes to reaching a fully confident state. There is still more to do before we reach that point.
Cool. That's been a very exhaustive uh, sort of a survey of your experience. Anna, any, uh,
Um, I think we can hand it back to Anvesha to see if there are any questions from the audience, and then we'll take it back from there.
No, there are no questions as of now.
cool.
So if you have any more questions, you can go ahead.
So this is more of a not from the, from a common general public perspective. We always, when we open an application, when we want to, there are a whole list of questions that are asked about us. But how do we ensure, all of this information remains private? So there is some sort of a concern. We can probably be all right when it is not very sensitive medical information that is asked of us. But how does as a user, what would you suggest are some of the best practices that a user can take to make sure that they don't give out too much of sensitive information, although some of those information is necessary to get to assessing what is going on with them, but in terms of their private information remains private. What are some of the suggestions that you would have?
So in most of the applications, I think so when there is a question asked to the user to reveal a certain information, for example, in ADA's case, it's a question answer kind of a format. So it's often information that is asked from a user where they have to select from the existing options that has been given. So besides the basic things, basic attributes like your name, age, and these are important to also kind of understand what kind of conditions that could be, decided by the algorithm. So aspects like if you're pregnant, are you a smoker, those kinds of informations are important. There is not much you could control from a user side on the information that is being provided. Of course, some can be marked as optional, like you can also say that, you can skip it, or you can say I don't know, or something like that. So there could be certain attributes that can be marked as optional, but things like, email ID, phone numbers, when you are downloading an application, these informations automatically go with, like, when you're installing the app and things like that. So I don't know if I can recommend anything for the user to be careful with what kind of information they're sharing, unless make sure that you only share the most important aspects and that are relevant for the questions being asked within the application. Most of the time it's a multi-option kind of an answer, so pick what is like the most appropriate choice. But within the organization, once a patient data has been captured, like in the form of reports and um, other patient records, there are several practices in place that can be handled to make sure that the privacy part is taken care of. So it's very paramount to kind of protect personal and sensitive data according to some of the best practices like encryption and access management and so on. So there are methods in place like encryption data, end-to-end encryption, which uses protocols like SSL, TLS, etc., to establish very secure communication channels. And these keys of encryption also are very securely managed to avoid any kind of, unauthorized decryption of sensitive data. A lot of the cloud providers these days come up with, inbuilt with all these services, and they can be leveraged and also carefully evaluated to make sure that the data is private. So I could talk about like a few things that engineering teams do to, prevent the data from being mishandled, like, data masking or pseudonymization, generalization, etc., which makes sure that PHI information especially is, correctly handled and not misused, or there are no membership inference attacks or anything like that. Is that okay? Does that make sense?
Yes.
Yes, I think that will be helpful. Yeah.
Yeah. So so then quickly around that aspects, data masking is a very common technique that is used, which is basically like you create a mirror image of the database, and then you do like implement alteration strategies such as shuffling the characters with, substituting it with different letters and so on. So it makes identifying this kind of data very difficult, or, reverse engineering very difficult. There are also techniques like pseudonymization, where you basically de-identify the tool that, provide private identifiers, such as swapping the names with John Smith, or, something like that, Marks, or something which are common names, so that you don't like directly get the identity of the person. There are also generalization, which basically um, removes like the details. So for example, in address, you remove the minor details of the address, but rather just keep the lane or the street, so that you still get the geographic aspect from that data, but you don't get, for more granular details of the person. There is also things like data perturbation, which is kind of adding noise into the data, to kind of, make it hard to identify. Plus, there is also synthetic data. So you remove the most important like PHI data, and you add in some synthetic data algorithmically. So a lot of these techniques are in place to manage data privacy once an organization accepts these PHI information. And a lot of these are also enforced by the regulatory authorities and GDPR. to protect patient information. So even for like cases, medical cases, a couple of those important details are masked before being sent into the engineering team for analyzing feedback or a particular case. Yeah.
Cool.
Sure, I think that's helpful. Any further questions from the group or from the audience, Anvesha? Otherwise, no further questions
No,
from
no,
my
there's
side.
no other question.
Okay.
Okay, Anand, anything else?
Nothing. Thank you very much. This is a pretty sort of a clear overview and a lot of detail you've given us. Thank you.
Thank you so much, Sharika.
I have to say
So
that it
I think,
seems like it's a lot
yeah.
of work, in the sense that, this, having all of these teams, all of these different processes in place. Yeah.
Yeah, it indeed, to especially because we are following all these guidelines and following international regulatory bodies. There are like very annual audits and both internal and external happening. So, and auditing group is a random set of people, so not just engineers or AI experts. So you really have to explain things in an understandable way to different kind of groups. And yeah, I think it's extremely important to understand that the pace with which technology is advancing and the pace with which such governance frameworks advancing is quite different. So we need more education around AI governance and data governance needed in the organizations before launching AI applications. And yeah, I think you guys are also doing a fabulous job to bring across this information to people, so that they can make informed decisions on how to use these applications.
Um, so I think it's also, commendable, Sharika, that you were able to touch on a lot of the in aspects that goes into a product before it actually comes into the market. So in some sense, I think as a general public user, not necessarily you may not understand all of the AI, but at least if we know that it has gone through all of these compliances, then for you can be rest assured that a lot of thought has gone into making sure that it is as safe as it possibly can be before it actually hits the market. So it's not some random product that is out there available. So I think that's very, very helpful for any general user of health tech to understand all of these frameworks that exist, why these checkpoints are made available, and what it actually protects them against. So I think you've managed to explain that really, really well. So thank you so much, and we appreciate your time. Over to Anvisha.
Thank you so much.
Thank you so much, Sharika. I agree it was a great session. And thank you everyone else for joining us. We'll have a couple more sessions on AI risk mitigation across domains, and this is sort of a running theme for the year. So if any of you are working on anything interesting, do reach out. There's a call for proposals also that's open on hasgeek.com. So you can submit a brief proposal and then we'll get back in touch with you. So that's, I think, about it for today. Thank you so much, Sharika, Anand, Hannah. It was a great session.
Thanks
Thank
a
you.
lot. Thank you. Bye.
Thank you. Bye bye.
Bye.